So, uh, when we're talking about depression, with relationship to a post-trauma event, you're looking at feeling down, feeling depressed, feeling irritated, feeling hopeless, in a significant amount of time, with relationship to a 2 week period. um, you might find yourself more than half of the days of those 2 weeks experiencing those, having that human experience of feeling down, depressed, irritated, hopeless, sad. You can also experience depression by finding yourself with no interest in things that you used to feel all the time, finding little pleasure in things that used to be pleasurable to you. You might actually also find yourself having trouble sleeping, reliving events, having memories or flashbacks of what happened with relationship to the trauma, having a hard time falling asleep because your thoughts are racing in your head, sleeping too much, or perhaps sleeping too little, of course. Your appetite could change. You might find yourself eating too little or eating too much, and generally eating too much because you feel anxious and you start overeating. Um, Feeling tired, feeling without energy, feeling pain in your body, even after you've even had some sleep or rest or were able to rest, you still feel tired and you feel out of batteries or out of gas. Uh, in the notion of moving or having lost everything at home and not being able to move anywhere or do anything, or finding yourself without a job, and unable to work because your work got destroyed. You might start feeling bad about yourself, or feeling like you're a failure, or feeling that you have failed, or that life has failed you, or feeling that you're letting your family down, which is one of the worst feelings a man or a woman can have in any situation. You might start experiencing trouble concentrating in simple things, just as watching TV or reading in the newspaper, or reading a book. Uh, you might start, and people would notice, and they might even mention this to you. You might start speaking very slow, or moving very slow. And um, when this happens, you usually are starting to experience motor function symptoms of depression, which is always concerning. Um, and in the most extremes of circumstances, you actually might feel that life is not worth living anymore, that you could actually be better off dead. Or thoughts might start intruding in your head of wondering, am I, is it worth it? Should I keep fighting? When you find yourself in that situation, understand that what you're experiencing is not typical, it's not normal, but it's nothing to be ashamed of, especially after the significant traumatic event that you've survived. And if you're watching this video, or if somebody shared this with you, understand that you survived. If you survive, you have the ability to be resilient and you have the ability to come back from this. But you cannot do it on your own. Other experience that is very common after a trauma event is the experience of anxiety. This is because when we are experiencing the trauma and we are in the midst of the trauma and our response of fight, flight, or freeze has initiated, our limbic system uh, get hyper aroused. Um, we become, like I said, hyper aroused, and we might develop feelings of nervousness, anxiety, edginess, in response to the natural reaction of what's happening. As a result, mm, you might endure that process of hyperarousal, which could trigger a state of anxiety, or a state of edginess, or a state of jumpiness, or a stage of nervousness. As this stage progresses, you might find yourself wearing too much, or unable to control your thoughts or unable to control your worries. You might start having trouble relaxing. You might feel restless. You might feel like it's hard to sit still. You might feel that you're annoyed by anything or get irritated by anything. You might feel fear for no reason whatsoever, um, or start thinking that something bad is going to happen. These are common experiences associated with anxiety in its generalized form. Um, Anxiety and depression with relationship to a trauma can then evolve into many different things. It can evolve into a major depressive disorder that might start impairing your ability to function daily, or on a generalized anxiety disorder that, in the same way, could actually cause that. But there is something that we call dysthymia or dysthymic disorder, which is a form of depression where you continue to feel these symptoms that I've mentioned before, but somehow you manage to push through. From my perspective, this is one of the worst stages or experiences of depression because any follow through or any following trigger or any following event can trigger a significant depressive event. Um, if we understand the history of our country, of our island, we understand that there was a significant amount of mental health issues before Hurricane Maria. A lot of people were struggling with emotional difficulties. Suicide rates were high. I believe about a rate of 24, 33, 33 per month. 24 per month. So at a rate of 24 per month. At this point, we're looking at around 33 um, events of suicide that have been documented in Puerto Rico. People that were already struggling with mild or medial minimal depression might now be experiencing higher symptoms and and are struggling to manage them, especially if they were able to just push through them, which is a common thing that we as Puerto Ricans tend to do. Yo brego, I will figure it out. Um, I don't need any help. Um, I can figure this out on my own. What people are going to think if I go to the psychologist or to the therapist or to the psychiatrist. I don't need any medications. That's something that I don't need. So at this point, if you were struggling with something before, like depression or anxiety or some initial symptomatology, some initial symptoms, you might be experiencing harder forms of this symptomatology of these symptoms. And what you do want to do is go and look for help. You don't want to continue to try to push through on your own, even though your resiliency so far brought you to this place. At this point, if you continue to try that, your resiliency might start to diminish, and you might find yourself developing impairments with relationship to your mental health, functional impairments, and emotional impairments. Um, Let me go into the notion of another significant issue that happens when you are dealing with trauma. One common thing that often happens, and we usually hear this term when we're talking about soldiers, but now we understand it to be a common experience to a response to multiple traumatic events. You have the notion of developing what is called post-traumatic stress disorder. You would know after a trauma event if you are indeed experiencing some form of post-traumatic symptoms. If you start having nightmares, if you start having nightmares of horrible, frightening experiences associated with, in this case, Hurricane Maria, or events that happen associated to Hurricane Maria. There is one thing that a lot of people are not talking, and it's not just the notion of the hurricane. So the hurricane was stationary in the island. People experienced this extensive amount of fear and disempowerment because it's Mother Nature that it was attacking you, so you cannot fight it back. Most people experience absolute horror during the event. But after Maria was gone, uh, they, there was no sense of recovery. There was no sense of coming back. There was nobody coming to the rescue. There was nobody coming to help. There was nobody to there other than your neighbors or your family members. People were expecting for an effective functional response from government, from military, and this took a very long time to come. Um, the sense of loss associated with this is one of the things that most people are describing to me in practice, not knowing what was going to happen, not understanding what was next, why was nobody coming to help. When you experience something like that, it's really no different than being in a combat situation where the future is uncertain. Um, on top of that, at one point or another, for what I'm gathering, actually, just recently, today, I had a conversation with a 4 year old who described his hurricane experience to me as in horror how the hurricane came. And he could hear his house, he saw his walls, and everything was just going to collapse. But the actual aftermath of the hurricane for him was the most horrifying aspect of it. He went out to help his father fill the gas of the generator that they were working on. He had managed to get one for the house. He went out with his dad, and as they were filling out the tank of the generator, this man showed up out of nowhere, asked his father for the generator. When his father tried to argue, they shot his father and him and took the generator. The child survived, the father survived. But imagine having experienced a hurricane and then the aftermath of that hurricane when finally this generator gets to my house, I'm going to have some electric. And these other humans that we would have expected that in a situation like this, humans would have behaved differently, right? Came and just shot this 5 year old and with his father in cold blood to take their generator. So these are the type of stories that I continue to hear every week of a woman that was assaulted just to have her cell phone taken away, an elderly woman. Uh, and stories like this, not only to the individual, but the people that are hearing it, start to affect the psyche and start to affect the motivation and start to affect in many ways, start to affect the way we experience each other as humans and the way we experience our environment. It's almost like being again in a war zone. And the term war zone is not something that I use lightly, but it actually accurately describes what a lot of the people that have been in the island and a lot of the people that I have that survived the Maria event um, have shared with me. So people can start experiencing this type of nightmares where horrific, frightening things happen. Um, if you find yourself trying hard to think about um, or try not to think about what happened, or if you start to avoid situations that remind you of what happened, or if you find yourself being continuously on guard or with a watchful eye or looking over your shoulder or being easily startled or in a situation where you actually um, feel so afraid and that you cannot relax, that you feel edgy. If you feel numb, if you feel detached, if you feel that you're disconnected from your average day to day activities, disconnected from your surrounding, you might actually be experiencing some form of post traumatic stress disorder manifestation. Um, there are, for professionals, if we have any in the group, I want to suggest that you consider. I work in an integrated care practice. This is something that I believe, for what I gather in discussions with different professionals in the island, is not a model that yet exists. So, integrated care practice is the notion that I work with a group of physicians as a behavioral health professional. I work with primary care, dental, OBGYN, pediatrics, all together in the same facility. We all share the same database, and we all communicate extremely effectively and meet regularly to discuss our common patients. As a result, our physicians have multiple tools that they use that are similar tools from behavioral health, but developed for primary care to explore things like depression, anxiety, and PTSD. I can suggest some. Please take note if you're a professional here listening to this video. If you want to actually determine if your patients are experiencing some form of depressive response, you might want to use a tool called the PHQ-9. The PHQ-9 or the PHQ-A for adolescents are tools specific for primary care to explore the experience of depression on adults and to adults, to geriatrics, and adolescents. There is also a form called the GAD, GAD-7 or GAD-8, which are tools specific to explore anxiety. And the PHQ-9 is a 9-question tool or screening tool, which can be a self-report screening tool. And the GAD-7 is a 7-question screening tool. And then you have yet another form that you could use for primary care to explore if one of your clients or in general your clients are experiencing some form of PTSD response. That is called the PTSD-5. And this is a 5 questions, a yes or no answer questionnaire. These tools are generally, like I said, self-report tools, and you should be able to easily add them to your intake screens if you're in a primary care setting. There are translated already to Spanish if you need to have, if the person that you're administering them to do not speak Spanish. I'm sorry, do not speak English. So I would encourage all health professionals seeing people today to actually implement these tools. And before you do that, consider connecting with professionals, mental health professionals, that you can generate referrals to. If you're in the Northern Virginia area, feel free to call us at Greater Prince William Community Health Center, and we'll be happy to work with you. In Puerto Rico, we have contacted Grupo CEPI that has been working extensively with us, and I've been providing them with a lot of data and information, and they have been providing us with a lot of data and information over the past several weeks. But they're doing an incredible job of supporting people in Puerto Rico, both functionally and emotionally. For mental health professionals themselves, if you're actually trying to obtain training on trauma therapy or things of that nature, feel free to reach out to me. I am working with a trauma expert in neuroscience, Dr. Sadi, and we're in discussions to see how we can actually bring training to the island. But in the meantime, if you're concerned about your patients and you're concerned about the response that they might be having, especially with children, you might want to consider using the NCTSN tool. This is a tool specific for children, and it's the Hurricane Assessment and Referral Tool for Children and Adolescents Revised. This actually is a whole assessment tool, and it gives you a total of 24 questions to explore any type of emotional response that a child or an adolescent might be having with relationship to post hurricane. Question that you are asking will be best answered in a very politically correct fashion. Um, they have not been working with me. No, they have not been working with me. I've been working with people here in Northern Virginia. There is a particular group that I have been working with, called Grupo CEPI, at no cost to them, and as them as volunteers who have been working extensively with people in Puerto Rico. They have been going town to town providing functional, delivering goods and supplies, and also providing emotional support. They have 40 psychologists all over the island. You will see in Voice of Puerto Rico, you will see the interview that we conducted yesterday for one of their directors. And tomorrow you will have another interview, which we conducted with another executive director of the group. And they have been our main sort of contact and work. So far, we have set up a training for them with Dr. Sadina. And yesterday we had a lovely discussion about the effects of trauma, that I called in, and we had a conversation before the interview that we were conducting. We talked for about an hour and a half about how to manage trauma and things of that nature. Again, if anybody has other questions, please feel free to ask. Let me give you a sense of what is trauma. Trauma is an emotional response to a terrible event. In this case, the terrible event is Hurricane Maria and the aftermath, where people felt so in a state of despair. Somebody described the situation as almost anarchic. And in that sense, I can see how that individual who is currently working with me in practice felt this. It was dystopic. It was like a complete dystopia, where there were no controls and there was no way of knowing what was coming back. Symptoms for PTSD tend to happen in two ways: either immediately after the event, where the person experiences shock and denial, or at a longer term or a later response reaction after the person comes down from the state of hyperarousal. So let me explain that, because this is actually very important. We are now at 55 days out, give or take, from September 20th. And many individuals that experience Maria have not been able to have time to calm down because they have been surviving. As things return to normal, people might start experiencing late onset of post-traumatic stress disorder symptoms or trauma-associated symptoms of depression, anxiety, and hyperarousal, things of that nature. This is very common, actually. We see it a lot in soldiers. I'm going to use the case of soldiers to explain. Soldiers, while you're in combat, you have a mission, you have to perform, you have to execute, and you don't have space to slow down or think about anything. So you go on survival mode. And if you were here earlier in the discussion, will remember my rubber duck. We have the cortex brain, external part of the brain, and then the subcortical, interior part of the brain. The interior part of the brain works on instincts. Instincts are responsive. You do not process events of fear. You react to events of fear. Therefore, the response of the cortical aspect of the brain, your smart brain, your higher brain, gets reprocessed, and it gets in, and every single reaction, event, movement, action gets processed in the subcortical portion of the brain. When things start to slow down and things calm down, or when soldiers come back home, In the case of Maria, as things become normal, the light comes back, water comes back, people go back to work. That's when the onset, when you don't have to survive anymore, when you don't have to run on your subcortical brain anymore, and you go back to your smart brain, to your intelligent brain, to your processing cortex brain, you actually might start experiencing symptoms associated with post-traumatic stress disorder like flashback, nightmares, feelings of depression, feelings of anxiety, feelings of hyperarousal, and things of that nature. Well, I reach them by email and Facebook. You could reach them by Googling Grupo CEPI, um, that, and I can actually provide you with a link to Grupo CEPI. Most people in Puerto Rico are not used to visiting a mental health professional because they may not want to tag as locals. How can someone suggest, without being offensive, that they will benefit from therapy? Oh, absolutely. This is a marvelous idea. This is a marvelous question. Thank you, Eduardo, for that. And this is something that I've been working on for the past several years in the Latino community here in Prince William County, educating people about the benefits of prevention. Uh, if you are concerned about developing diabetes, high blood pressure, or anything of that nature, you actually go to your physician and you do a physical every year. Most people don't see the need to do that when it comes to mental health. I'm not sure why, because our brain is part of our body and it's a functional aspect of our body. Actually, if you think about it, it's the matrix or the hard drive of our body. Is the aspect of our body that keeps everything function. But nobody does preventive medicine for the brain. Um, the easiest notion to provide to somebody is that there is going to see a mental health professional. Most people are more comfortable starting with a therapist or a counselor. It's no different than going to see your primary care doctor or your OBGYN professional or your dental professional. That is always my recommendation. As a notion of a statement, if I'm close to the person, I will go with them to make them feel comfortable. Most therapists in the United States and in Puerto Rico would not mind having a support system present during an initial consultation to explore if the individual, if the patient, if the client, if the consumer, there's many terms that are used to describe the person that is coming for consultation needs therapy or not. There is an important notion that I want to also bring to people's attention is the notion of psychotropic medications. Psychotropic medications in the same way that psychostimulants, for example, for children with ADHD, la medicina, the medicines. A lot of people have this tendency to focus on, well, I'm going to go to my psychiatrist or I'm going to go to my primary care doctor. I'll get an antidepressant, I'll get an anti-anxiety medication, and that's it. Understand that there are multiple benefits to taking medication. Taking medications for difficulties with depression or anxiety or bipolar disorder or schizophrenia or any other mental health disorder is no different than taking medications for asthma or diabetes. No different whatsoever. There's a lot of stigmas, but we as human beings of this new millennium, we need to start breaking from this stigma of the past. There's a lot of fears about addiction to these medications. And I always speak on this subject because it's very important for people to understand what addiction really looks like. No psychotropic medication causes addiction. Let me rephrase that. No antidepressant medication causes addiction. There are some class 1 medications that are generally for anxiety, to manage chronic anxiety, that could cause some degree of addiction. But that's not usually what you get initially prescribed to manage depression and anxiety. The first course of treatment is usually an SSRI. When you're prescribed an SSRI, a lot of people say, well, I cannot function without the medication. I must be addicted. This is not an accurate statement. You're not addicted to the SSRI. You have not been able to enter in a process of therapy where you can correct the functional, environmental difficulties or the emotional struggle that initially caused the depression or the anxiety. Now, when we're talking about medications, there are very specific structured ways of administration, and sometimes these are missed by professionals, even those that prescribe. Uh, Initially, for example, you can consider administering an antidepressant for a person that is having their first depressive episode for 8 months. You should suggest for the person to attend therapy while they stabilize on the medication. And medication should be seen as that, a stabilizer. There has been a functional change of the brain. There's some chemical imbalance happening due to an environmental reason, and this is for individuals that are developing depression out of nowhere. When that happens, for 8 months, the person should take their medications and do therapy and try to engage in functional change, life changes. Um, and once they do that, maybe you can get like a bigger thing because it's very hard to read from that little paper. Mira, ahí tienes una libretita. Thank you. Sorry about that. Life event. Eh, when people do that, and if they do engage in change, there's a significant amount of people that are unable to come off the medication and don't have any more depressive symptoms after, or anxiety symptoms for that matter. I see that in practice all the time. And I openly refer people to take medications, and I send them to different primary care physicians or psychiatric providers that I work with. And again, I'm talking about depression and anxiety. There's major depressive disorders and dysthymia and anxiety and generalized anxiety disorder and adjustment disorders, which are some of the more common diagnoses that you would see when you're talking about a post-trauma event. Now, if the depression were to come back after this 8-month period or symptoms were to resurface, you're looking at the second episode, you might need to spend at least a year on the medication. If you find and continue to do therapy, of course, and try to observe what else can I do to change my lifestyle. And we will talk about lifestyle changes in a minute. If after a year you try to discontinue medication and symptoms come back, you might actually be one of the few individuals, because there's not many, to be quite honest. There's a lot of myth around this. But you might be one of the few individuals that actually have an actual disorder that relates to a chemical imbalance of your ability to generate serotonin and dopamine in the brain. This in itself is not your fault. It's not nobody's fault. It's just the notion that the same way that you will have chronic asthma or chronic diabetes out of your genetic coding. So it's something that you might need medication for the rest of your life. But the majority of the people that I see in practice that tell me I've been on medication for 7, 4, 6, 9 years for depression, and I'm addicted to it, are people that have never. We have tried to reach out to Dr. Kelleher, who's actually here in the Washington, D.C. area teaching at a local university sometimes, for what I gather. To discuss Dr. Sadina's offer to go to Puerto Rico and engage mental health professionals all over the island. During the previous Rosselló administration, there was a law that was passed to facilitate the acquisition for the Department of Education of school psychologists on site at each of the schools, in the same way we have them here in Prince William County. Each school has assigned school psychologists, and in general in the United States, this is the case. School counselors and school social workers are present in the school system, but in general, even here in the United States, not all of them across the board in their educational processes actually receive training to address significant stressors and issues such as trauma, but they know to refer to individuals like me and individuals and other professionals in the community that have expertise in trauma recovery and treatment. There are many individuals in the United States, but specifically in Puerto Rico, that are psychologists and that are counselors and that are professionals. To what extent these individuals have been trained to address the specific needs of the population with relationship to the high level of trauma and potential development of PTSD that after Maria, the island might see, that is still a question. I've talked to at least a group of 40 different psychologists, and they tell me that the tools are not complete. The toolbox is not complete. So I would venture as a guess to say that the school system right now does not have the training or the readiness, the actual readiness to address the needs of children in the school system that might start struggling with emotional difficulties associated with the natural event Maria. That's something that we as a group are advocating in the island. We're advocating for money for training for the Department of Education. We're advocating for school psychologists to be present in the schools, because there's a law that was passed several years ago for that to happen. We're advocating for an increase in training specific to trauma, and we are also trying to bring trauma experts to the island, myself included. I don't mean to brag, but that's my professional reality. I'm an expert in the subject of trauma and recovery. I understand very well why it's important to see a doctor in mental health. Yes, Damelis, that is true. Eso es muy cierto. La gente en nuestro pueblo, en nuestro país, en nuestra islita, tienen dificultades entendiendo lo importante que es ver a un profesional de la salud mental. Y esto es común en las minorías. This is very common with minorities, not just Puerto Rico. And in general, people in general tend to be hesitant. They don't want to be stigmatized or told that you're crazy, estás loco, estás viendo al psicólogo. But we need to break away from these notions, because these are notions that are not real. These are notions that make absolutely no sense. Any other questions that people might have? I wanted to talk about, so I talk about some tools that primary care professionals can use. I talk about two self-reports that people can access online and screen from themselves. Please don't use those weird, check if you're depressed. No, there's very specific tools, professional tools that you can use. And if you score high on them, consider please talking to your primary care doctor, talking to your counselor, reaching out to a counseling entity around you, reaching out to a pastoral counselor. There is a notion of mental health and religion that I also want to touch on. And religion is extremely important for people to sustain their sense of resiliency. And there's a lot of pastors and priests and ministers that train in pastoral counseling. But please do understand that if you're struggling with something as severe as PTSD, you need specialized help. Not just any psychologist with a PhD or a master's degree can help with PTSD, not any licensed professional counselor, not any licensed social worker, clinical social worker can help. It has to be a person that has specialized training in trauma recovery or in cognitive restructuring for trauma, or in trauma-focused cognitive behavioral therapy. So ask questions. Do you understand trauma? What trauma model do you use to treat the needs of an individual who has been hurt by an event like Maria? What is your experience? This is something that you would ask of of your primary care doctor or your dentist or your OBGYN if you have concerns. You should be able to have the same conversation with any type of mental health professional or clinician that you're seeking help from. And if they cannot give you an answer that makes sense, or they feel in any way offended or defensive, you might want to look for somebody else. Again, for professionals in the field, I'm suggesting that you start implementing as a regular protocol the use of tools like the PHQ instruments, PHQ 9 and A for adolescents, the GAD-7 and GAD-A, PHQ for depression, GAD for anxiety, and the PCPTSD-5 for post-traumatic stress disorder symptoms. There are multiple programs, and I will need to know what jurisdiction you live in. For example, in Virginia specifically, we have the community service support systems across Virginia, and they all have different resources available to them. And financially, across counties, they all have different programs to help people. There are multiple federally qualified health centers, like the one I work for and the one that I run the behavioral health department for, or the behavioral health practice for. And they have different levels of specialty. My particular federally qualified health center is actually a full mental health counseling therapy practice, but we don't have a psychiatrist on the team. So we do work with our primary care doctors to address depression and anxiety symptoms, collaboration with therapy. So we have the ability to prescribe medications to stabilize and then engage in the process of therapy to reconstruct and look for functional life changes. Centers like mine have grants that might help with the cost of services. Centers like mine also have fee schedules or fee deduction schedules, where based on your income or lack thereof, you might find yourself paying an extremely reduced fee for service. Some professionals that work in the community also have this type of fee deduction schedules. The CSB can provide services at extremely low cost. In Puerto Rico, Grupo CEPI has an open offer to help people and provide services also in the community, and they have been doing that for several weeks since the hurricane event took place. So reach out to them. We now have a link in the discussion area for the group. Tell Dr. Colon or Dr. Amarilis that I actually refer you there from this conversation. We said that we were going to talk about the nature of the national disaster, nature of trauma, nature of depression, anxiety, PTSD. I think I've covered all those subjects. How does this look? How would this look on real life? Let me give you a couple of examples. You might find yourself engaging with people at home after the hurricane. And as you engage with people at home after the hurricane, you might find yourself, for no reason whatsoever, seeing your wife or husband engaging in these two different dynamics. De momento, se manifiesta la depresión, la ansiedad, el PTSD de maneras muy interesantes. Usted puede encontrarse con su esposo o esposa cabizbajo, sin motivación, sin apetito sexual, molesto por ningún motivo, reactivo, explosivo o explosiva, reactiva, sin ningún motivo. Le hiciste un comentario y te salió ladrando. Eso en general marca que la persona puede potencialmente estar lidiando con algunas dificultades relacionadas a la depresión o la ansiedad. So just to recap on that, when you're at home with your partner or with other adults in the house, or relatives, or um, mom, dad, grandma, teenage children, or children in general. Children also experience depression, anxiety, and PTSD. You might find them to be reactive or overreactive, explosive, impulsive, um, sad, seemingly for no reason, crying, having experiencing crying spells, dismotivated. Your partner might find him or herself struggling with uh, emotional changes, where they actually might feel unmotivated, they might feel hopeless, they might feel uninterested in things like sex, for example. Um, Exploding out of nowhere, for maybe you made a comment and there was an absolute overreaction and they bark at you for no reason whatsoever. So those are usually markers that there's something not right. So keep that in mind. Another mark of things not going well is an escalation of alcohol use. Um, all of a sudden, a person that might drink socially, all of a sudden find themselves drinking again and again and again, day after day, more than usual. That usually is what we refer to as self-medication. The person is struggling with anxiety, struggling with depression, struggling with sleep problems, struggling with emotional distress, and they drink to try to calm themselves down or slow down the emotional struggle. How much of a medical record can be requested by hiring companies and entities when you're seeing a mental health professional? I know some folks that do not because they are afraid of losing or not getting a good job. Oh, tremenda, tremenda, Miguel. All mental health professionals are bound by HIPAA, which means that we cannot release any type of HIPAA and FERPA, thank you, and we cannot release any type of records to anyone without your consent. It doesn't matter. The only way we can actually release a record, and us as psychologists have in the past stood even against this at the cost of our freedom. Let me be clear about this. Many psychologists have been ordered to release records in subpoenas, and they have denied them because they believe that the release of the records would jeopardize the mental health of the patient. And I know psychologists that have been held against in contempt of court for refusing to acknowledge a subpoena. Um, so this is how serious we take this. The only way a mental health record can be released is if you as the patient authorize me to. Now, if in any way, shape, or form you are suicidal or homicidal, sometimes confidentiality has to be broken, and this relates to the specific event. So I might call a person that you have designated as an emergency contact person, or I might call a hospital where I'm trying to get you hospitalized. In certain jurisdictions, we do something that is in Virginia, for example, we do something that is called the TDO and the ECO, and that's done usually through the CSP system, the Community Service Board system. And in those cases, I would need to refer you to a community service screener, or if in the situation that you don't want to go voluntarily to the hospital, I might need to contact the police. Police records with relationship to TDOs are also not made public in the same way that criminal records are made public. Uh, so that's another thing to keep in mind. So even in those situations, it usually does not get past that notion of HIPAA and FERPA, and confidentiality can be easily broken. There is no easy way. This is something that people tell me a lot and ask me a lot. Can anybody look at my records once I'm here for mental health treatment? No. Most entities, sadly, we have in DC, they were starting to move to uh, general medical records, where everybody that was working in the mental health field in DC to actually see the records of a patient. But that does not exist that does not exist in most states. Definitely not in Virginia, and definitely not in Puerto Rico. So people in the island that are seeking help, they might find themselves with an EMR that is localized to the clinic or practice that you're visiting, and they will have no contact with anybody. And records should not be released. Legally, that is your right. Do not have your records released unless you authorize them. So it should not affect your ability to get a job unless the job purposely requests that you release all medical records to them. Um, there's one thing that we therapists do, and I do this commonly often, is that I have a structure for billing health insurance, and that structure has very specific DMAS requirements in terms of what we call a functional assessment, a symptoms assessment, and a mental status examination, a treatment plan, and then some CPT codings. And when we do that, the note is very vague. So our conversation, I record separately and independent charts, or I commit to memory, which is the so that's another way to sustain confidentiality, even when the record is released. Most people, unless they're in the mental health field, would not understand the information that I've documented. So there is a context of helper fatigue, and there's a context of vicarious trauma, and in the case of a natural event like this, direct exposure to trauma and direct exposure to human suffering. In a situation like that, it's extremely helpful that you engage with in training. There is a training called Mental Health First Aid that you can seek and receive. But if you're currently volunteering, you want to reach out to professionals, you want to reach out to your peers, you want to reach out to your spiritual leaders or people that you trust and discuss and talk about what you're experiencing. um, you you could explore in one of the tools that I mentioned earlier in the video to see if any of the things that you're experiencing are listed there. You might be experiencing depression, you might be experiencing anxiety, you might be experiencing PTSD. Let me jump real quick with this question to what can I do? Uh, your diet. Your diet is extremely important. We are a whole entity. We are not separate mind from body. Therefore, our endocrinal system is connected to our neural system and is connected to our brain function. Uh, we generate chemicals in the brain that are associated to uh, triggered by biological functions. So as a result, you need to eat healthy. You need to focus on their diet. You want to decrease the amount of intake of alcohol. You want to decrease the amount of intake of cigarette. You want to decrease the amount of sugars that you're putting into your system. All of these things are deterrents to your well-being, overall well-being. You want to engage in exercise. If you are unable to see a therapist right away, you want and you have access to something like YouTube, you might want to pull down some meditation videos and try to meditate. There is a frequency of meditation that you find videos online that are extremely good for just breathing and relaxing. And these are the 432 hertz meditation. Um, this
My mom's pain
this
from
act-
moderate to severe rheumatoid arthritis was intense. I wondered if she could do
this is actually something that is extremely helpful for people to just sit down and listen to music like the one that is playing right now. Soft music, 432 hertz. You can find videos in music in YouTube at this level. 528 to 432 is the recommended frequency for meditation music. And you could see, just when you go to sleep, you could just put some headphones on with this music on. You want to try to exercise, you want to try to engage in Tai Chi practice. You can find Tai Chi intermediate and beginner videos in YouTube. YouTube is a marvelous tool. Huh? Yoga. Of course, I was going to get to yoga in a minute. Yoga training, intermediate, beginner. Yoga training also, multiple videos that you can find online or in the area. You might want to reach out to any place that they teach yoga or Tai Chi and try to engage in that process. Going for a jog, going for a walk, being conscious of yourself and stopping, being absolutely conscious of your stress and taking breaks and pausing. The mission, this is a long-term mission. The Recovery of Puerto Rico is a 10-year mission, to be quite honest. If we look at the event that happened with Katrina, it has taken 12 years for that event, the people that experienced that event, and the locality that experienced that event to recover. There's FEMA personnel still in New Orleans today. So you want to actually make sure that you pause and you take a break and you talk to somebody and you process. If you're in Puerto Rico, I'm going to take again, I'm going to make the suggestion that you reach out to Grupo CEPI or any other mental health group, organization in the area um, near you, or you seek advice from perhaps a pastoral counselor in the area, minister or priest in the church, somebody that you can talk to more freely and openly with a sense of no judgment. Things that I do for meditation. Uh, I actually encourage people to engage in what I call mandala meditation. With music like this in the background, I ask people to look for um, dark chocolate, high in cacao, 75%, uh, dark chocolate and mint also, a mix of the two. I ask them, I provide them with mandalas, which are metaphorical symbols of man and the universe. Uh, Carl Jung actually spoke a lot about mandalas, and you find them in the Native American tribes, in the Indian practices, tantric practices, and other philosophical Indian practices. Where you find them among the Inca and the Maya. They're very common, I think, across many cultures. The mandalas in many different ways, shapes, or forms. You can just Google mandalas, and you will find sketches that you could download and paint. In absence of a printer, if you're in a place where you cannot access printer, but you can perhaps access the internet through your phone, just Google mandala and you will see a circle. And these circles have different symbols inside or different patterns inside, and you can just work on coloring those while you listen to music, while you eat some dark chocolate in your mouth, while you put some aromatherapy. Um, I actually use a lot of essential oils, preferably things like these are essential oils. And you can find this in any pharmacy. And there's some that are already elixirs, that are mixed oils, like this one that is called Mental Clarity, and then this one's for happiness, lavender. These are things that I generally recommend for people to use. And you just simply take one of these, whichever, and you actually just pour a little bit, put it in your different areas where you can actually smell them throughout the day. problem in your hands. If you're feeling stressed, you want to develop a mental health toolkit of any kind, and essential oils for relaxation are always very important and very good to have around you. You can keep your mandalas, and if you're very stressed, you can pull coloring pencils and just stop and take time for yourself and smell your essential oils. Put on your headphones with slow music for 132 hertz, draw, and continue to smell your essential oils and breathe. Breathe deeply into the abdomen, fill in your lungs, put your body straight, hold the air, close your eyes for a second, hold it, and let it out slowly. And that's a way of centering. Engaging in the process of centering is extremely important for your mind to relax. And this is in general for all individuals. We live in a society that is very always going fast and it's extremely demanding, and we forget to slow down, pause, and make time for ourselves. Um, any other questions?
Gardening is a suggestion because you work with your hands. And
Gardening
help
is,
people
of
relax.
course, gardening is a suggestion. Any activity that gets you in a process of relaxation, meaning crocheting, gardening, drawing, writing music, playing the guitar, playing any type of instrument, anything that disconnects you from the stressor is beneficial to you. Yes and no. PTSD is an experience, it's a human experience, so it's different across the board. Um, Let me give you an example. I was working with a child recently who experienced an extreme level of trauma, um, two hurricanes, and a post-traumatic loss of a family member, and he actually was shot. It was the same child that I was talking about earlier, and his biggest struggle is the notion of anger. So I was explaining to his mother that his expression of anger is not necessarily anger at something or someone. Hello, Cleo. How are you? You came to help. Um, Cats help for relaxation. Um, his his expression of anger is a way to try to regain his power. Trauma, the biggest single factor that affects individuals that experience trauma and post-traumatic stress disorder is the sense of losing your power, your ability to control your environment, your ability to control what's going to happen next. And a child that has been so significantly traumatized, the anger, the rage that is boiling up inside comes from anxiety and fear. Children can, depending on the age group of the child, they might revert to early stages of development, and they might start having accidents. Um, the pee pee, the poo poo, the caquita. They might actually start sucking their thumb again. You might find them crying. You might find different manifestations. Learning might be affected by children's cognitive processing in general for all ages might be affected. We have Dr. Sedina has multiple studies on the subject of the traumatized brain, and she kindly explains in her publications and in her discussions and trainings how some people might score poorly on IQ testing with relationship to trauma and not necessarily a cognitive dysfunction or intellectual uh, or developmental incapacity. So any changes in the ability to concentrate of the child, any changes in the ability to perform in school might be associated if they have been exposed to a traumatic event to that. Any reactivity, explosivity, sudden impulsivity, again, feeling depressed, feeling anxious, developing fears, irrational fears, starting seeing imaginary friends is very common in children that have been traumatized. Um, So all of these things might be markers of needing to talk to a please. At this point, if you are experiencing any of the symptoms that I've described, if you're struggling with any difficulties of the things that I've mentioned, uh, please reach out to a mental health professional. Please talk to someone. Please look for somebody that you care about and that you trust and share your experience. Please seek help if you're in the island. Reach out to Grupo CEPI. They're all over the island. 40 psychologists working hard to help people there, or to any other mental health practice that you're familiar with in the area. If you're going to reach out, ask questions. What is your expertise with relationship to trauma? Um, Feel free to talk to a psychiatrist, discuss the options in terms of medications and integrated care treatment. Don't stick to just medications. Trauma does not resolve by just medicating someone. Symptoms might ameliorate absolutely immediately, but they would not provide you a long-term solution. Um, Traditional martial arts. Let me talk about that. That's a particular subject that I love. Traditional martial arts have an incredible amount of research since the 1980s. And I realized this while I was doing my dissertation on the benefits of martial arts for children with ADHD and ODD. On the benefit of for people that have experienced trauma, they help with empowerment and they help with an increase of exercising and the benefits that how those the exercising reflects in the neural process. It helps you with the traditional martial arts are keen in meditation and grounding and focusing practices akin to dialectic behavioral therapy, which is a model of therapy that is very peculiar because it incorporates some Buddhism or Zen Buddhism meditation practices. So when you're talking about things to do, yoga, Tai Chi, traditional martial arts, uh, things like running, things like swimming, and again, just stopping, meditating. If you research Google for any of this, you might find videos online that can help you engage in practice if you don't have access to a school. If you do that, please be mindful of your body. If you're doing something that is too strenuous or if too painful, stop and look for another alternative or switch patterns along the lines of mental health first aid. The first thing is identifying what's happening. A person that is in shock, you want to assess for risk, safety in the environment, and to self. You want to observe in the environment if there's any type of weapons, knife that they might engage in self-harm. If they're in absolute shock and in a state of catatonia, it's always good to sit beside them, talk to them, make eye contact, ask permission before you get close. People in shock sometimes react, could just throw a punch or something of that nature. So just talk to the person in a calm, passive tone of voice, like the one I use for this conversation that we're having today. Be present and be mindful as you engage the individual, and just tell them that you're there to help. Uh, Tell them your name, ask them their name. If they're unable to respond at the time, just give them the space. You could ask questions specifically if you're concerned about them being in a state of dissociation or being confused or being disoriented. You can ask standard questions for the MSCs. Do you know what's your name? Do you know where you're at? Do you know um, uh, do you have any children, any family members in the area? Do you know what's today's date? Do you know what floor you're in? So these are kind of I think that you and I spoke before, and you might have mentioned that you had medic training. Perhaps not. Maybe I misheard or misunderstood. I've had several conversations, but the mental status exam, I can actually send you a list of questions privately on how to engage individuals in doing a mental status exam. The biggest suggestion that I have for you is to be present and sit down beside the individual and just allow them to process, and allow them to understand that you're there to help, and allow them to be able to decompress if they need to, or to engage in catharsis if they need to, in safety, and be in that space of safety for them. If there's a degree of dangerousness to the situation, you want to help the person move away. I never suggest lifting somebody up or anything like that. I usually ask people to stand up, grab my hands. I help them stand up. I pull them up. I grab them by the arm and I walk them out to a safer space. Um, eh, situations are situations are always different. So there's no one. What we call in my field an adjustment disorder, that is usually associated with a chronic trauma. Uh, Treatment wise, there are several methodologies of treatment, specific to children, specific to adults. There's cognitive reconstructing, there is trauma informed cognitive behavioral therapy. When a person is struggling with that, the most important thing to do is try to find them help from a mental health professional. But as a friend, or as somebody in the field, not having access to a mental health professional, just helping the person talk. Again, the process of therapy is a non-judgmental space, a safe space where an individual can speak and nobody will make fun of them, nobody will make comments that are unnecessary. The role of the therapist is usually to be a passive listener, where the person can actually process through their emotions. And in certain pauses in the process, we actually engage in a discussion of introspection to help the person introspect into their own internal thoughts and the thoughts that they're presenting to us. So what we tend to do, if we were having a conversation and somebody's telling me no, because the world is gonna end, and after this hurricane that happened, for example, just giving you a random example at this point, this hurricane destroyed everything, and we're now never going to survive, and we're not going to be able to get out of this. And there's a lot of extenuating, extreme, radical black and white thoughts that people might engage when they're in distress. When that happens, what we try to do is help them listen to themselves. So what you're trying to say to me is that you're very stressed about this, and that you're not finding a way to process through what you're enduring at this point. What else do you think we can do together? Or what else could you do and I could help you engage in doing in order to help you cope with all this stress? That would be kind of a standard statement with relationship to a dynamic. I would not suggest that you try to do therapy in the field because you don't have the training. And people that in general, not just you, anybody that does not have the training in therapy, even if they were physicians, I would not suggest it. Um, but I would do suggest that if you are with somebody that is struggling with something like that and they have no access to a mental health professional, to please just be patient and be an active listener and non-judgmental listener to that individual. I can again connect you with Dr. Amarilis Ramos and Dr. Colon, who are with Grupo CEPI and who are traveling across the island. I'm actually glad you commented on this post because I was just thinking this week that I should get you guys connected because they are doing a lot of work in the field also in Puerto Rico, and you guys could potentially collaborate, and perhaps even it will need to be a discussion and conversation with the directors of Grupo CEPI, but perhaps they could actually have one of their therapists person is in significant distress or in any way, shape, or form, in a state of catatonia or in thinking of self harm, you want to take them to an ER. this will be the best course of action. Even if they are angry at you after the fact, you will save their life. If I understand your question correctly, it's not necessarily at risk in terms of immediate risk, but at risk of developing chronic mental health issues. If they're at immediate risk, you want to assess for safety in the environment, secure any type of item that could be used as a weapon. And I'm sure as a military guy, you know as well as I do that anything can be used as a weapon, but there are very specific things like knives, guns, ropes, shoelaces, belts that are more commonly understood to be the things that you can actually most easily utilize for non-trained individuals. So you want to remove those. You want to keep the person on a 24 suicide watch, 24-hour suicide watch, and you want to try to, if you don't have access to the AR, those will be the protocols to follow until you can get them into an ER as quickly as possible, where it can be assessed by a mental health professional, psychiatrist or psychologist, or preferably, or if not, primary care physician or an emergency doctor that could provide them with some relief through some form of psychotropic medication to avert the crisis. Si de momento se encuentra en crisis, esto es muy importante, si de momento se encuentra en crisis, si de momento te encuentras teniendo pensamientos de que la vida no vale la pena, de que la vida es muy difícil, de que lo has perdido todo, acuérdate que siempre hay otro día y que hay personas que están ahí para escucharte y personas para las cuales tú eres importante. Habla con alguien, busca ayuda. Si no hay nadie a tu alrededor, llama al 911. Vete a un hospital, vete a la iglesia, habla con el pastor, habla con el ministro, habla con el cura. No tienes que estar solo. Las dificultades que estés pasando en estos momentos no las tienes que superar solo, y no debes sentirte menos fuerte o menos hombre o menos mujer porque vas y buscas ayuda. Al contrario, hay que ser sumamente valiente. We're going to try to do one more on the subject of education, since there were education questions. If you're in the Northern Virginia area, please know that here in Greater Prince William County, Greater Prince William Community Health Center, we have offices in Dumfries, we have offices in Manassas, and we have offices in Woodbridge. We're here to help. Reach out to the behavioral health team, and we will do our best to provide you with the services that you need. Integrated care, primary care, pediatrics, OBGYN, dental, and behavioral health. Remember, we're here. Voice of Puerto Rico is working for you. La Voz de Puerto Rico está aquí trabajando para usted. Cualquier preocupación, pueden contactarnos a través del grupo. Alguno de los moderadores del grupo, si es una pregunta específica, podemos tratar de ayudarle, o podemos enviarle un teléfono para que nos puedan llamar.